Welcome, and thank you for taking part in the self-guided video series aimed at supporting your efforts of becoming an informed and empowered advocate. In this video, you will learn about Medicaid expansion. On June 17, 2021, the Supreme Court rendered a verdict central to the mainstay of the Affordable Care Act. The court dismissed the challenge to the ACA, thus essentially validating access to health care for millions throughout the country. Yet, health care in Georgia remains elusive for many and marked by disparate access among poor, minority, and rural communities. Why is Medicaid expansion important? In addition to one of a few states that has yet to expand Medicaid, Georgia has the nation's third highest rate of uninsured individuals, behind Texas and Oklahoma. Medicaid expansion is a matter of life and death. Hear from Georgia State Representative Sam Park of House District 101.
Hello, my name is Sam Park and I represent House District 101 in Georgia. When my mom was diagnosed with terminal cancer in 2014, it taught me firsthand the importance of having access to health care. That access to health care is a matter of life or death. And her fight inspired me to fight for the 500,000 Georgians who still do not have access to health care today. My mom was able to access treatment thanks to Medicare and Medicaid, and so I've made Medicaid expansion a central tenet of my work as a state representative. The need for Medicaid expansion in Georgia is clear. We are in the midst of a healthcare crisis. Our rural hospitals are closing at an alarming rate. Maternal mortality rates are among the highest in the nation, especially amongst Black women. And the rate of uninsured children is rising, and we are in the midst of an opioid crisis as well as an HIV epidemic. Medicaid expansion could cover 500,000 Georgians who make too little to afford insurance. And if we expanded Medicaid to the full extent under federal law, the federal government would cover 90% of the costs. The state of Georgia recently proposed two healthcare plans. Unfortunately, after years and millions of dollars spent studying and talking about Georgia's healthcare problems, the plan they put forth does too little to address the challenges we face. Our plan expands Medicaid, one plan expands Medicaid, but only to about 50,000 people. It creates burdensome work requirements that will cost the state more money. And since they didn't expand coverage to the extent allowed under federal law, the federal government will only pay 67% of the costs. The other plan addresses private insurance. It puts private insurance companies before Georgia patients by forcing Georgians to use insurance brokers rather than healthcare.gov to find insurance. And it puts caps on how much financial assistance the state can give to those who need help to afford healthcare, which could force some families onto a wait list. The kicker? This plan costs the state more money than Medicaid expansion while covering only a tiny fraction of the people. Last year, I lost my mom, and every day I miss her. I'm so grateful that thanks to Medicaid and Medicare, she was able to see me serve 2 terms as a state representative where I could fight for more Georgians to have access to health care. And I need your help in this fight. I need you to speak up. This proposal does little to ease the crisis Georgians currently face, but there is something we can do. Georgia is taking public comments now until December 3rd, and you can submit yours at coverga.org. Georgia can't waste more time and money on incremental steps. We know Medicaid expansion will save lives. So submit your comment today to help expand coverage to more than 500,000 Georgians.
Georgians also favor Medicaid expansion. Polling data from the Georgia Budget and Policy Institute shows a top priority among Georgians is investments in health care. Specifically, 64.5% of those polled supported expanding Medicaid. Consider also, Medicaid expansion benefits Georgians beyond providing health care for the uninsured.
Too many people are left out of the healthcare system in Georgia. Did you know that Georgia has the 3rd highest uninsured rate in the country? We're also one of only 12 states that still has not expanded Medicaid. Not only would expanding Medicaid provide healthcare access to hundreds of thousands more people in Georgia, it would bring economic and social benefits to every part of our state.
Medicaid expansion would have huge implications for school children. Students on Medicaid miss fewer classes, they do better on grades, they're more likely to graduate high school. Policy-wise, there are so few things where you can actually save money and increase outcomes for children.
Healthcare access is important for college students to get the care they need so they can stay in school and succeed. The Affordable Care Act allows states to expand Medicaid, leading to the percentage of uninsured students dropping by more than half in the United States. Medicaid expansion would protect even more students in Georgia.
Medicaid expansion would bring up to $1.9 billion of upfront funding to Georgia that would be enough to cover the state's costs of insuring the estimated 500,000 Georgians who would be eligible for health care for several years, and enough to help make key investments across our healthcare system in behavioral health, in public health, and to help restore the healthcare infrastructure that has been decimated or pushed to the brink across much of rural Georgia. Medicaid expansion would also create tens of thousands of jobs.
Let's talk about a major opportunity being missed, Medicaid expansion, which can improve public safety and economic mobility by 1, linking incarceration exiting Georgians who have the highest likelihood of chronic physical or mental illness to coverage and care that can improve their health and reduce their chances of recidivism. And 2, by bolstering a safety net to lift the crippling cost burdens of healthcare for impoverished Georgia families, allowing them to use more of their earnings toward education and work supports that create economic mobility.
Expanding Medicaid to more than 500,000 people is a simple choice for lawmakers.
So, Georgia, we have much work to do on behalf of individuals currently without access to health care. Together, we can roar for health care.